these supplements are notorious for increasing blood pressure, so you need to be cautious. Guys, I'm Dr. Jen. It's good to see you. The first one is a supplement called Arnica. Now, this supplement many people take for like aches and pains, inflammation, maybe wound healing, things like that. This is a supplement absolutely that can increase your blood pressure. I should say, and I've said this spiel a lot in my YouTube videos, especially about vitamins and supplements, that in the United States, vitamins and supplements are not tightly regulated by the Food and Drug Administration. That means a number of things. We don't have a lot of data about them. We don't always know how well they work, and if they work, we don't have good studies. Also, it can mean that sometimes pill forms or the bottles, we don't necessarily have a good idea of what's in them. There may be varying amounts of the active ingredient. The list goes on and on and on. So as you know, I've always said to be cautious about vitamins and supplements. Everything you take should be run by your doctor, and understand that vitamins and supplements, just because people say they are natural, does not mean that they are necessarily safe. All right, the next supplement is ephedra, okay? This is also called ma huang. It's often been used to treat things like asthma, allergies, hives, even like bronchitis and cough, okay? The third supplement is ginseng. Now, this is one that many of us hear about. This has often been used to treat or deal with things like stress, infections, or even diabetes. The next is guarana, okay? This is actually one that you may have associated with like energy drinks and things like that, and that would be a fair sort of connection. It often contains caffeine, right? So we're talking about supplements that can raise your blood pressure. This makes perfect sense. The next is licorice. Interesting, but licorice, many people will use it to help with digestion, infection, cough, etc. And I have two more, by the way. Because I am saying that many people use them for X, Y, and Z, please understand that in many of these cases, we don't have good evidence that these supplements and herbals actually fix these things, okay? I wanted to let you know what most people take these things for, but the evidence is not necessarily great, I would say, overall, and certainly for some of these supplements, we don't have much evidence, if any, that it does these things. So please keep that in mind. It's another reason why I say you've got to talk to your doctor and let them know what you're taking. Okay, the last one you're definitely going to recognize, but let me start with the second to last one. That is bitter orange. That is something that people may take for weight loss, for athletic performance, and even energy. And then the last supplement, again, I know you probably know about this one, St. John's wort, okay? People may take this for depression or for ADHD, for other mental health conditions, etc. I actually have a whole video on St. John's wort because it actually can have lots of different side effects, not just potentially increasing the your blood pressure. Okay, so I'll make sure I link that here on Facebook. If you're watching, just ask me for the video. I'll send it to you. The bottom line here is that anything you choose to take outside of prescribed medications, you've got to tell your doctor about and make sure it's okay for you. Okay, you understand? And remember that something that is claims to be natural does not mean that it is safe or that it is right. Guys, I'm Dr. Jen. Please subscribe to my channel. Follow me on Facebook. I'm on Instagram, LinkedIn, TikTok, WhatsApp, etc. at Dr. Jen Caudle. Subscribe to my free health newsletter at drjencaudle.com.